is, I think, October 22nd, actually. Let me confirm. Yes, okay. So we're a day ahead here on our slide. We're here to talk about community health and how it goes into the policy plan. So a brief overview, and I will actually pass this part on to William, who's doing this introduction part.
Yes, good afternoon, everyone. As stated, I'm William Nance from the Department of Planning and Development. I'm joined by Anna Ricklin and Zach Larnard. And this is a brief overview of today's presentation. Next slide. Thank you. So in December 2022, the board authorized a complete review and update of the policy plan with three major goals: to review, update, and streamline existing policy plan elements, add new policies as needed to address topics such as community health and equity, and to ensure the policy plan is in alignment with the strategic plan and other recently adopted or endorsed board plans. Next slide, please. So before we dive in, here's a brief overview on the difference between the comprehensive plan and the county's regulatory documents to help frame the work of this amendment. Comprehensive plan is a guide that sets the land use vision for the county and is implemented through the development review process of zoning applications. The policy plan includes goals, objectives, and policies. Goals provide the general direction of the plan. Objectives include statements to help achieve those goals. And finally, the policies include specific approaches for pursuing an objective. The policy plan applies countywide, therefore it's important to ensure the policies developed are general and flexible enough to apply across the county, but also targeted enough to address the topic we are working to improve. The area plan volumes, the comprehensive plan, provides specific guidance and recommendations pertaining to development within the areas of the county to ensure that development is addressing area and site-specific considerations. The zoning ordinance is a regulatory document that applies to all structures and is intended to promote health, safety, and general welfare of the public and to implement the comprehensive plan. And finally, the PFM provides the specific engineering guidelines for development and construction. Next slide, please. Thank you. And so here is a timeline of the project. We're currently in the focus topic outreach phase of the project, where staff is preparing research and information with the goal of starting to draft policies in the fall based on board adopted documents, outreach input received, and best practices. This policy development work will continue into 2025 with the goal of publishing a community feedback report and draft policies in the first part of the year. The community feedback report will include the feedback received and how it was implemented. And with that, I'll turn it back over to you, Anna, to discuss community health.
I'm on mute. Don't worry, we'll have questions at the end. And so definitely write your questions in the chat or write them down on a piece of paper so you don't forget if you have questions about this kind of the overview. And now we'll dive into health and place. And so a lot of you might have heard the phrase that your zip code is more important to your health than your genetic code. And that's really the idea that where you live, where you grow up, where you have the opportunity to go to school, what schools are available to you, what kind of neighborhood you live in, where you live vis-a-vis resources like grocery stores or doctor's offices or other social services can really shape how your health turns out over your lifetime, what choices are available to you. And so this is just a quick overview of that concept and the idea that health is shaped over our lifetime of living in homes, using transportation, accessing services, making choices based on what we have nearby. And health is also one of the most tangible ways that we can measure equity or inequities between different racial groups, gender, people of different generations who are living in the same place. A couple of data points for you about our health condition in Fairfax. Now, on the surface, Fairfax County is a really healthy place. We have high ratings for health outcomes across the board, but those are an average. When you look closely at the data by zip code, or in this case by census tract, we see that there are some significant disparities across populations. And a lot of times we can predict where these places are in the county, and if someone lives there, what options or health conditions they might have. So when it comes to physical activity, something that us in public health are very concerned about, we see that at least 20% of adults in these neighborhoods listed here say they get no physical activity outside of work. And so, of course, that prompts us to wonder why. And there is some community engagement going on that the health department is leading to understand why aren't people engaged in physical activity outside of work? Does it have something to do with the built environment? Does it have something to do with the trails or lack of trails that they have available to them? Or is it other social factors? The top 5 areas in the county are listed there where we see people getting the least amount of physical activity. What else goes into physical activity? Well, biking and walking to work is one great way to stay healthy, but we see that just a tiny percentage of people across the county are using biking or walking to get to work. And we also see that nearly half of workers travel 30 minutes or more to get to work. And so most of the time, those are folks driving, or if you're taking transit, you're probably transferring buses and traveling for more than half an hour that way. But for the most part, you're sitting still. And so that's time that you're not able to exercise. And it's obviously really stressful as well to sit still in traffic trying to get to work for a long time. And then if you are walking, whether you're trying to get to work or not, it can be really dangerous. We see an average of 172 traffic crashes involving pedestrians every year in Fairfax County. So that's a little bit about how our physical environment can relate to our health and physical activity. Next, we see about healthy eating and nutrition. And again, in a lot of neighborhoods, um, families are food insecure. So we see 26 census tracts across the county where at least 530 households are food insecure. That means they don't have enough food to get through the week, or they're concerned about how they're going to buy food because of limited resources. Not exactly the same places as where people aren't getting physical activity, but there is some overlap. On the other side, we see that people are struggling with being overweight, and nearly 1 in 4 Fairfax residents are obese. So we have a food environment that could use some improvement with making foods more accessible and available to people, while also helping people make healthy choices, providing healthy foods for folks, and of course, encouraging physical activity. Over the long term, these things add up, and they add up in what we usually use as life expectancy as kind of the ultimate measure for a healthy life, and how long your life is kind of tells a story about the resources that you had available to you to stay healthy. So this is just a handful of census tracts I've noted here where folks are living the longest in Fairfax and where folks are living the shortest. So it's a 13 or 14-year age gap between people who are living the shortest versus the longest. It's not the biggest age gap that we see in other parts of the country that might exist, but it's a pretty significant number to see that people are living 13 years shorter in certain parts of the county than in others. So I want to cover kind of a logical pathway for how different components of our built environment could be impacting our health. So the first is transportation. Transportation is a really significant part of our built environment. It's a really significant part about our planning, and it's one of the topics being worked on for the comprehensive policy plan. You might have had the opportunity or will be attending a session just on transportation. But when we look at transportation and what the health impacts can be, we see some direct impacts right away. Poor air quality is not good for our respiratory health, for breathing, for people who might already have asthma or might already have a respiratory illness. Bad air quality caused by transportation services is one of the number one health issues. Of course, traffic crashes and injuries is another direct impact. No pun intended. If you are hit by a car or you are involved in a car crash within a car, that is a very direct impact on your health. And then cardiovascular health is also affected by air quality because the tiny, tiny, tiny particles in the air can actually pass through the lungs and into the bloodstream and impact your heart health. But over time, we see that some of these impacts, these acute impacts of transportation, can actually add up into what we might think of as less direct, indirect impacts over time. And so the noise and the stress of living near a big road, for example, can really wear on your mental health. It affects community and social connections. If there's, again, a large road or even not that large a road, but one that's heavily traveled, that can separate communities. You wouldn't let your child cross the street, and so they can't really easily visit with the neighbors on the other side. And then, of course, the transportation options that are available to you can affect your access to education, your access to jobs, access to services like grocery stores or healthcare. So all of those things can add up to affect your health over the long term as well. These are some of the things we can do about it. These aren't the only solutions. These are just some ideas of how we can integrate a health consideration into how we're doing our plan. So including pedestrian infrastructure, places for people to walk. A lot of the places where people are hit by cars, there's not enough crosswalks, there's not enough sidewalks. And of course, that the walking infrastructure can connect and add more options to transportation. You can get to the bus more safely. How we're thinking about what types of buildings and land uses we are having near major roads to consider the exposure of, say, an elementary school next to a major road. Is that something that we want to be doing? And then finally, just how we design our roads, how we design our roads if people are going fast or if people are going more moderate speed, if there's a network of streets so that there's more options for traffic of all kinds to flow. So at a high level, these are just some ideas. Next kind of broad category is the environment, the quality of our environment. Some of the direct impacts of our environment are, again, respiratory illness that comes from air quality. We also think about water quality and how much we're having to treat our water and the systems that our water has to go through to be treated, as well as stormwater and where does stormwater go. This can affect our cardiovascular health, again, mostly through the air quality piece. The environment, depending on the conditions, can be stressful, and that can be a very direct, immediate impact. And of course, heat. With the climate heating up and summers being hotter, heat can be a really acute problem, especially in places where we have more pavement, bigger roads. Some of the longer term impacts, we're thinking about community and social cohesion again. The education and learning can be impacted over time by the stress of heat, the stress of the environment, mental health, and as I mentioned, chronic stress can cause significant problems, especially from heat. So as we think about what types of components to include in our plan, some of them are already here. We are already thinking about impervious surface and where should be thinking about de-paving or making sure that water can go somewhere and that we can have a cooler environment. Trees and green space help with that as well, and green buildings. So some of our data sources, I'm going to zip right by that. So new directions, and I'm going to pass it to Zach to talk about some of the examples we found of other plans, including health.
All right. Thank you, Anna. Thank you, William. So as we've been looking and researching this topic, we have looked at several different jurisdictions, both nearby and far away, to see how some other areas are tackling health and looking at community health and how it can be incorporated into their comprehensive plan. So one right nearby is City of Fairfax. They had a new comprehensive plan approved in 2022. And some of the chapters and some of the way they organize their plan looks at land use, multimodal transportation, environment and sustainability. And it kind of starts to get to some of these things that we think we can include in our community health section of the plan as well. And so one of their goals is a sustainability initiative to support physical activity and healthy lifestyles. That goes to a lot of the things Anna was just speaking about. And also, an interesting topic that they've included as well is access to healthy and regionally grown foods. And our food systems are an important thing that can impact community health. And some of the action items that Fairfax City has included are some interesting ways to allow for more urban agriculture, or here in multifamily buildings to make sure that there's community gardens and things like that so that people can grow their own food. And also the county and the city are working together to develop a healthy food access plan. So I think that can also be something that'll be part of our policy plan to allow some of those things to happen. And the next place that we looked at was also a neighboring community of Montgomery County in Maryland. And they also adopted their new Thrive Montgomery 2050 comprehensive plan, which is looking forward to the year 2050. Also adopted in 2022. And this is also looking to create communities that offer equitable access to jobs, housing, transportation, parks, public spaces. And these things can help guide the design of the built environment to strengthen social and physical health. And that's what we've really been seeing in a lot of this work, is how the built environment can impact people's everyday lives, especially when it comes to health. And so one thing that the Thrive Montgomery 2050 plan is looking at is embedding social connections and public health into their land use planning to create places that encourage and make it easier for people to meet each other and engage in activities. And just like the example Anna gave with transportation, if you can't cross the road, if the infrastructure isn't there, it's really hard to make those connections with your neighbors. So I think those are some good guides and things that other jurisdictions are doing. And I'm not sure if you're familiar with the current Health and Human Services elements of the policy plan, but it is outdated. It was written in 1990, and it has not had any updates really since then. And this goes back to one of the goals that William mentioned for the comprehensive plan and policy plan update, is that we want these to be usable documents. We want them to be accessible to people to use the guidance that's in there, and not just be a plan that sits on the shelf for 30 some years. But the current plan, it was a lot of the guidance comes from a section called the Principles of Human Services, which was developed by the Human Services Council in 1989. And a lot of the text focuses on facilities, like where to place a senior center, when you need a new senior center or a new community center. And even these guidance and this, these guidelines have, they're outdated now. It was written in the 90s. Things have changed. The county has changed significantly. Best practices in community services and mental health care and all these things have changed. So it's important that we look at this holistically and we think about how we can update this plan to be more in the 21st century, because we also have new guidance from the county for the One Fairfax and the strategic plan goals, which will really help us go in that more forward-thinking direction. And a lot of the text regarding facilities, we're looking at putting that into the public facilities element of the policy plan, which recently had an update, and then we'll probably also have another update coming soon once these other sections are updated as well. So that's where we are now, and those are some of the goals that we're looking toward and things that we can do based on seeing what other jurisdictions have done. So I'll let Anna take this. This talks a bit about the strategic plan and goals that are included in that section.
Yeah, thanks, Zach. So, Zach mentioned that with the Human Services current chapter, which is kind of all we've had for health in our plan, and it's quite indirect about health, has that part of what makes it more is outdated is that we now have additional higher level guidance from our countywide strategic plan and of course the One Fairfax racial and social equity policy. And so this is what is actually in the strategic plan, if you haven't read it recently, about basically health in place, health and planning. So integrating those considerations of health, well-being, and equity into our land use process is from the Healthy Communities chapter. And then separately in another section of the plan, Housing and Neighborhood Livability talks about linking the county's public health and equity agenda to a public space agenda by updating the comp plan, which is what we're doing now. So with that guidance from the board, we are looking at these 5 broad buckets for how we are going to organize our plan. And this is actually the last slide that we have for you before launching into discussion. So the 5 areas that we're looking at for the community health section will be 1, right up front about healthcare and services, access to healthcare, access to services, considering how we're planning for these institutions, how we're going to connect public transportation and other transportation options to the places that offer healthcare or human services. So that's kind of will be the scope of that. And then talking about the food system, what's going to be in our plan when it comes to food production, food waste management, food distribution. Those things are not really anywhere right now. We have some pieces of our zoning code that talk about urban agriculture, but we don't really have a holistic guidance on the food system. Of course, addressing active living. A lot of the guidance for active living, you see here this little picture of someone riding in a bike lane, will be in our transportation section. We're not going to be in the business of duplicating what's already in the transportation section or providing guidance that could be not in alignment with what's in the transportation section when it comes to how to build a sidewalk, where should sidewalks go, that kind of thing. How should bike lanes be designed? We're really going to be looking to our transportation colleagues and also those in Parks and Recreation who are working on things like trails and playgrounds and parks and just parks in general and other types of recreation, sports, etc. Those things will be covered in other sections of the plan, but we are going to address active living here as a important component of a healthy community. I talked about green infrastructure and healthy buildings. Some of that guidance will be covered in the environment section. Maybe some of it will be covered in the land use section of our plan, but we're going to touch on it here as well. And then finally, social connections. What are some things like placemaking that we can include in our plan to ensure that people have places to connect with one another, to support one another, to be civically engaged, all of those things that we know, again, make up a healthy community. So with that, I think, yeah, we're at questions or discussion. I'm going to stop sharing for now. I can bring something back up if anybody wants to see something, but would love to hear from you all. Your reactions, questions, input, what you want to see to make a healthy community.
Yeah, and I think we've got a small enough group, so don't worry about raising your hand. Just feel free to ask a question. I think we can.
Yeah, agreed.
Well, I'll go ahead and go first because it's quiet. My name is Larry Zaragoza, and I have a couple questions. One is, I didn't hear you speak about lead contamination, and you're probably familiar with the fact that EPA is in the process of, or has recently changed some of the lead standards. And so, while we may have been okay on lead before, it's not so clear to me that with the new standards that we'll be meeting them. And lead can be a really problematic contaminant, particularly for kids. And I wanted to raise that to you. I hadn't heard anything about that question. I was also really pleased to see in your chart that you were going to have a focus on medical care, because as you went through the discussion, the medical element didn't stand out. But the social connections piece that you talked about really seems like more of a transportation piece, although that's tied in with the active living. And so, well, you were saying that maybe you would not be you would kind of look to the other groups like transportation or the environment for that work. I would really encourage you to think about uh, working with them, because the interests that you have are going to be different than the interests that those groups will have. And you have an expertise and appreciation for some of these issues that is going to be different. And so if you can engage on that part, I think it's gonna I think it will be helpful. So anyway, I'll stop there.
Yeah, thank you, Mr. Zaragoza. I should have mentioned that we are collaborating with those folks. I did not mean to imply that we're just going to let them, do that stuff and we'll just say refer to them. We're absolutely collaborating. We have weekly meetings with the whole team, and we actually, the three of us did. Had focused before these conversations with members of the public, we had focused conversations with each of the topic areas to get a sense of where they were going. And so absolutely, we're going to be helping to integrate some of the health and human service notion into the work being done by transportation and the work being done by environment and other groups. Just as a note, recently human service transportation as a service, which is something that the county offers for folks to be able to get to doctor's appointments or to get to adult day health care, has actually recently moved into the Department of Transportation. So I think there's an increased sense in transportation about paying attention to those needs, those more social needs as well. And then not that the plan is supposed to reflect the business of the county. It's really supposed to outline where you as residents of the county want to see the county developing and how we want it to develop, what our values are. And then your point about healthcare, yes, I mean, there's some limitations on the ability of this plan to call for particular kinds of healthcare. For example, we can have language in the plan saying, ensure that, or not ensure, some verb, allow the creation of continuing care facilities that offer these kinds of services, but we can't prescribe. There should be one in Chantilly, and there should be one in Seven Corners, and there should be one in this other place. That's sort of up to the market. But what we can do is say we want to see a mix, right? We don't want to see only continuing care. We don't want to see only nursing homes, or we don't want to see only giant hospitals. We want to allow for a mix of different types of healthcare services. And so a lot of it is really about, I'm coming to realize, a lot of it is really about providing definitions of things so that those things can happen. And then so if some developer comes in and says, I want to do this, it's not like, oh, we don't have that in our plan, you can't do it. We don't want to be that way. We want to be flexible. We want to allow for different types of things to come in. And then on your question about lead, so the comprehensive plan is not, we don't have jurisdiction over, say, the water, Fairfax Water in the planning and how they're doing their water filtration or those kinds of things. Obviously, I have a lot of faith in Fairfax Water and their ability to ensure that we have clean water. So we kind of rely on other regulatory bodies to look over the lead issue. And then me working for the health department, if there are kids, kids are screened for lead at the pediatrician's office. I have young children, they were screened for lead. And then if there is, a higher level, we actually do get informed about that and do some investigation to understand what's going on there. But that's kind of on an individual basis, not something that goes into our comprehensive plan. So I hope that's helpful.
Yeah, that's true. I also agree with you about Fairfax Water, but there's also the lead dust issue. And so if you have there was an article in the Post just the other day, and they were about renovations. And if you have a renovation, I guess in this case they had a 1-year-old, and they ended up undertaking a renovation, and there was lead dust in the old home, and the child ended up with a elevated lead level, and so a lot of that has to do with standards that the county oversees with respect to building and inspections and what's required, what kind of checks and balances are going to be needed. So because a homeowner may not appreciate that they have lead paint in their home unless they've tested for it, and even if they tested for it, if it's flaking lead paint, that's a lot easier to figure out. But if it's been painted over, it may not be so obvious, and it looks just like everything else. So it makes it a little bit harder. So I think that may be worth just taking a look at that question on lead.
Yeah, thank you. Yeah, we could potentially include, there's a lot of redevelopment happening in the county. So, the newer buildings don't have lead, but the older buildings, kind of inside the Beltway is a kind of rough line of where those places are. Could, as we're doing redevelopment in those places, we could, it could be a more of a problem. And so, yeah, we can look at that.
And the good news is lead paint was banned in 1978. So you're going to have to go to properties that are older than that. And even before 1978, they stopped using lead paint for the most part. It was a kind of a specialty.
Yeah. Ms. Marvin?
Hi, this is really a lot of great information. I'm new to the Human Services Council, so I appreciate all of this work and knowing the history of everything. But before that, I worked for Family Services for 35 years. So I started in 1988. So yeah, if the policy goes back to 89, yes, it is old. So, and really that was high level for me as a benefit. I did the benefit side, the SNAP program, Medicaid and things like that. So that stuff we as workers really were not impacted by or know, but it really is. I'm just starting to learn with my work is how important in the coordination of things, because we could do SNAP benefits. I could make you determine your eligibility for SNAP benefits, but if you didn't have access to a good store. I remember we went out to South County area, and really a lot of the area within walking distance were little mini supermarket, little shopettes, not something where you could get high quality, good, affordable food. So this is really just valuable work that you're doing. So I do appreciate that. So thank you.
Thank you. Yeah, I think
thank you.
Things
and one thing I wanted to mention, just as sort of not an answer to a question, but just another piece of information for both of you. One thing that the county is doing is we do have, through the strategic plan, through some of the work that the health department's doing, we are able to get some additional data that's a vulnerability index that we're using to look at some of those areas of where the county, where there may be greater need in the county, and it looks at all those different details, and those are some of the things that where we can't necessarily direct the private market to build. It's something that when we are providing county services, we can certainly look at that data and sort of see where some of the need is, looking at it from a slightly different lens. So both when it comes to like older structures or food systems, I think that data can help us in seeing where the need is throughout the county. So just wanted to add that piece of information as well. We do have new data that we're using in these processes.
Well, and I'm also seeing an incentive for businesses in the area to get on board with us in a way, because if you want employees to be in the office close to your office buildings, not having issues, be healthy. You've got to invest in the community around your buildings then. So just my thought on that. So thank you.
Yeah, it's
So-
true. Yeah.
I would like to go back to your comment about using the vulnerability index that the county has. I assume you're talking about the one Fairfax indices. So one of the things that I think is important is that when you use information like that, it's important to understand what the factors are that go into feeding that particular index. So the way the county has put forward that index, it's not clear. You know what kind of data went into it, but you don't know. At least I haven't seen the weights that have been given to the different elements, and it may be that some of the elements would be far less relevant than others. For example, I'll use the example of cooling. Um, if you have an older population and they don't have and they're very limited financially, that's a very different situation than a older population that is very well off, that has air conditioning and whatever other resources they might need. And so just looking at the index, the way it's constructed, it could lead you to results that might give you some results that may not be desirable, because the priorities that you would get may not reflect what you really want to achieve. Does that make sense? So if when I used to sometimes do this kind of work, and what I would always do is I would try to pull out the different factors that go into it, think about the goals that I might want to achieve, lay out the weights, and run those past people. You can't see that the way the county system is currently constructed. One of the things I do is I sit on EQAC. I'm the chair of EQAC. And so we plan to meet with the equity folks, the One Fairfax folks, within the next couple of months. And this will be one of the topics that we'll be discussing. But I think I like your idea. I think you need to find some way to kind of go out and find out where you want to focus. And I think that is a good idea. I would also suggest that you think about metrics, and because if you don't have any metrics and goals, then you kind of never know if you've been successful. And so you could continue to spend resources and you could vastly improve your situation, but you could never claim success. And on the other hand, if you can do almost nothing, and it's hard for people to say that you've not done enough. So, and that, I think that leaves people frustrated. So I think metrics, I think, can be your friend on this one.
Yeah.
I think you're completely right.
Yeah. Thank you.
And I also think, to your point about data, I believe it's equally weighted, but you'll hear from them directly about it. But also, I think, the using the vulnerability index is like a start, and then we have to look deeper than that. We can't just only make decisions based on that data. And we have some of the other health data that I shared. It's actually part of an extensive report called the Community Health Assessment that the health department released last fall. And so there's a lot of other health data included in that report that I just didn't want to take up time going over today and isn't necessarily relevant to kind of the bigger discussion. But in terms of our approach, that's certainly that we're going to use the Community Health Assessment, the Vulnerability Index, and also community input. So the health department is now going out and, well, it's actually concluding a long process of going out to those communities where we saw the worst health outcomes. And talking with them about why and trying to understand what's going on. We called them a root cause analysis session. And so we did like 25 of them. with community members and to understand where they're, first of all, does this data feel right to you? Does it feel like this is your experience? And then following up with, what do you think the reasons are for us seeing this data? And one of the things that I have included in other presentations is a slide on kind of the high level review of their feedback and how that relates to some of these built environment factors that we can be looking at. So we're using a lot of different methods.
Good.
Yeah.
I also want to comment that this is the fourth one of these meetings I've sat in on so far. And I really appreciate the thought that you have put into all of this, because it's clear you've been thinking about this issue and you have good ideas about where to take it. But I really think that all of these meetings would have been better if there was greater specificity that could be discussed. To only have two people show up to a meeting is, there's three of you here. The comprehensive plan is a big deal. It can have a huge effect on our future, particularly when an applicant goes in for a special exception. And we can get some of the things that we really need. I used to work for the federal government, and I was involved in redevelopment. And one of the things that we would do is we would as things got redeveloped after being cleaned up from contamination, we'd work with the community, figure out what their needs were, and it might be that they wanted more medical care. So they wanted a drugstore, they wanted doctor's offices, they wanted grocery stores with fresh food. And so we try to design things so that we can get developers to come in and offer those kind of services. And it seems like you're trying to do the same kind of thing here. Mm-hmm. And I think that's really good, but to have greater specificity about how this process can and will make life better would be good, because it's all of these meetings have been very, very vague, and I also see a lot of overlap. I think the transportation one I thought was really good. There they had more metrics and more specificity, I think. But I think one of the things I like is that the ideas that you have and the things that they're talking about are very much in alignment. And I would expect that you probably could, maybe you already have, but you could kind of work things out so all your language is consistent and it all goes together and comes across seamlessly.
Mm-hmm. Yeah, thank you. Thank you for that. And we know it is early in the process. I think there's additional community outreach going to happen when we have more details for folks to react to. But so I appreciate you taking the time now, even though it is a little bit more high level, a little bit broader. And we will absolutely be coordinating with Bob Pecora and his team in transportation. Well, if no one has any further comments or questions, we certainly don't need to keep you here. And happy to receive comments by email as well, or additional thoughts that you have later. Thank you for taking the time to sit with us this afternoon.
And Anna, is there someone that we could follow up with if there's a follow-up question? For example, something may come up in a transportation or environment discussion, and maybe it would be good to know who we could contact if there was a contact that we could have.
William?
Anna, there is a contact on the PowerPoint, you can send it to the larger contact for the project itself. I think it's one of the last slides, Anna, but if you go to the project webpage, I believe it's there as well.
But that's for the entire project, correct?
Yes, but should be able to distribute that out to the correct topic leads. And the project manager is also on the topic lead team for the environmental environment elements. So
Okay.
I just put it in the chat.
yes,
Is that the one, Zach, William, that you
I
read?
believe so. Yes.
Okay. Well, thank you, Ms. Marvin, Ms. Zaragoza. I appreciate your time.
Thank you. Bye.
Thanks,
Bye.
everyone.
Thanks, everyone.